Viscosupplementation in osteoarthritis is a controversial subject and has been the subject of much study worldwide. In this expert view talk, my aim is to share with you my personal experience with the use of viscosupplementation in osteoarthritis in my own practice, and hopefully give you a couple of tips which you could translate into your practice. Osteoarthritis, being a degenerative disease, is a journey from very mild pre-symptomatic osteoarthritis to severe osteoarthritis with deformities requiring a total knee replacement. There are various stages in between, and it is very important that we pick and choose the specific therapeutic modality that is appropriate for a given individual in the given circumstance. So the watchword is use a tailor-made approach when approaching viscosupplementation as a therapeutic option in osteoarthritis. And the short answer is no, it is not suitable for all patients with osteoarthritis. When I am selecting a patient for viscosupplementation with osteoarthritis, and here we'll refer specifically to the knee because that's the most commonly affected joint and the most commonly affected area where we use viscosupplementation. So the first thing is, regardless of age, they should not have a significant angular deformity, varus or valgus. They should not have a flexion deformity, and they should not have mechanical symptoms from a correctable intra-articular pathology like a meniscal tear. So if they are neutrally aligned, they do not have any mechanical symptoms or signs, the next question we ask ourselves, what is the stage of osteoarthritis? So I personally would use viscosupplementation most commonly for the KL radiological grade 2 and occasional cases of KL radiological grade 3 arthritis, provided they are angularly neutral, no flexion deformity, no intra-articular pathology, and no rheumatoid arthritis either, or inflammatory arthritis. And secondly, in the ICRS stage 2, 1, and sometimes 3 as well, which we shall discuss a bit later in this talk. So to summarize, a patient who receives viscosupplementation should have the intermediate grade of arthritis, that is grade 2, maximum 3, both radiologically as well as by cartilage scoring on MRI or arthroscopy. They should have a neutral alignment and no intra-articular pathology. This kind of patient would be a good patient to select viscosupplementation in. Viscosupplementation after arthroscopic surgery is a very interesting indication for viscosupplementation, because here we have had the advantage of seeing the joint firsthand, correlating with the MRI, addressing the mechanical symptoms. That is, if they have a symptomatic meniscus tear which is not responding to conservative treatment, then you've done either a repair or a meniscal balancing procedure. You've done some form of chondroplasty, either using an ablation device or a shaver or microfracture, or by the use of one of the cartilage replacement procedures. And in these kind of situations, where they are neutrally aligned, you would definitely think of viscosupplementation for patients who have had the ICRS stage 1 or 2 and occasional stage 3 lesions. And I usually would prescribe viscosupplementation to some of these patients after 4 to 6 weeks interval between the surgery and the injection. I must also add that sometimes we come across patients who have had ACL reconstructions for neglected ACL tears. These are patients who have had tears which have occurred about 8 or 9 years ago, and now they're about 41, 42. They want to get into a fitness regime. We do the ACL reconstruction. They have early osteoarthritis, ICRS 2 or maximum 3. And these are good patients in which we would also do viscosupplementation after an interval of 4 to 6 weeks following the arthroscopic procedure. Now, this is a very common situation where patients with advanced osteoarthritis have seen a surgeon who has correctly advised total knee replacement because of the advanced arthritis and the appropriate age group. And then we find all of a sudden that they get cold feet. Either they are not prepared for surgery or they want to delay the surgery, and they've read about viscosupplementation either in the lay press or seen some information on the net or have heard about it from their family physician, and they come desperately seeking an alternative. Some of them will ask for viscosupplementation, and in these cases, viscosupplementation is truly a disaster. In patients like these, they typically have pre-existing deformity. They are often bone on bone, stage 3 to stage 4 arthritis in different parts of the knee. And this is the way in which viscosupplementation gets a bad name. So I think it's important for us as a community of orthopedic surgeons to resist pressure from the patient if they come and say, "Doc, I don't want to go for knee replacement. Please give me a viscosupplementation injection instead," because you have to counsel them that this would give, if at all, very short-term relief, and it would not be the appropriate use of a good product. These are the days where medical practice is driven by many factors. Apart from clinical judgment, doctors tend to get influenced by what the patient wants or what the patient has heard about from the internet. And very often patients come with a request that, "Doctor, my relation in the United Kingdom or the US has had this viscosupplementation injection. They are very happy. Is it available in India? Would you give it to me? And I'm happy to take the injection. Please give it to me." So here again, I want you to remind yourself, and we as a community should remind ourselves, that the choice of therapy should be suggested by the treating doctor. The treating doctor would first of all consider whether the person is fit for viscosupplementation, an appropriate candidate, and the suggestion should come from the doctor. In the rare situation where the suggestion comes from the patient and the doctor feels, yes, it's a good idea because he or she meets their clinical criteria, by all means, you can go ahead and do it. It's not an ego issue. It's an issue of doing the right thing. So simply because the patient demands it, please do not give it. But if in case you feel convinced that it meets your criteria for viscosupplementation, please go ahead and do it. After viscosupplementation injection, the patient quite justifiably asks us, "Doctor, how long do you think the benefits will last?" And it's important to answer this question truthfully before and after giving the injection so that you can set the expectations correctly. In my personal experience, in the very well selected patients for viscosupplementation, the benefits last for a minimum period of 6 to 8 months and a maximum period of a year. Usually, the people who do not get benefits are those who are selected poorly, and with proper counseling and proper understanding of the limitations and benefits, I have seen 80% of my patients telling me that they feel 80% of benefit for 8 to 12 months. That's been my experience. So to conclude, I would like you to think about this, that osteoarthritis is a journey from mild osteoarthritis to severe osteoarthritis. Our treatment protocol should be customized and tailor-made to the patient's requirements and benefit. Viscosupplementation is a useful tool in the hands of us surgeons to use appropriately. And if you use it for the right indications, that is, patients who have no mechanical symptoms or after resolution of the mechanical symptoms by arthroscopy, no angular deformity, and intermediate level osteoarthritis radiologically as well as arthroscopically, then it's a useful tool. Please go ahead and use it. Don't give it a bad name, because you would give not only the class of viscosupplementation a bad name, but yourself a bad name by selecting it for the wrong indications. So use it well, and it's a useful tool, and you'll be happy to see the results.